Welcome to the Booker T. Washington Awards Luncheon. My name is Jennifer Fisher Clay. I'm sorry, I have to get used to my last name. I just got married, y'all. And, and I just hear my husband's voice in my head saying, don't forget to say Clay. So, my name is Jennifer Fisher Clay. It is an honor to serve as your guide through the next hour, where we will honor some dynamic leaders in health. I'm happy to be here. I absolutely love this meeting because this is a great opportunity for us to come together, to learn from one another, and explore solutions that we can take home to be a light to the lives in our community. So thank you to the National Minority Equality Forum and the CBC Health Braintrust for all that you do. I think we're going to go ahead and get started on the first award, and I will present the first award. I have the high honor to present this year's Booker T. Washington Leadership Award. Dr. Regina M. Benjamin is former Associate Dean for Rural Health at the University of South Alabama College of Medicine in Mobile and past chair of the Federation of State Medical Boards in the United States. In 1995, she was the first physician under age 40 and the first African-American woman to be elected to the American Medical Association Board of Trustees. She served as president of the American Medical Association Education and Research Foundation and chair of the AMA Council on Ethical and Judicial Affairs. In 2002, she became the first African-American female president of a state medical society in the United States when she assumed leadership of the Medical Association of the State of Alabama. Dr. Benjamin is a member of the Institute of Medicine, the health arm of the National Academy of Sciences. She is a fellow of the American Academy of Family Physicians. She was chosen as a Kellogg National Fellow and a Rockefeller Next Generation Leader. Past board memberships include the Robert Wood Johnson Foundation, Kaiser Commission on Medicaid and the Uninsured, Catholic Health Association, and Morehouse School of Medicine. She was named by Time magazine as one of the nation's 50 future leaders aged 40 and under. She was featured in the 1995 New York Times article, Angel in a White Coat, the December 1999 cover of Clarity magazine, and the 2002 People magazine's article, Always on Call, and was featured on the January 2003 cover of Reader's Digest as one of the national publication's Everyday Heroes. She was also named Person of the Week on ABC's World News Tonight with Peter Jennings and Woman of the Year by CBS This Morning. Wow, that's a lot. There's more. In 1998, Dr. Benjamin was the United States recipient of the Nelson Mandela Award for Health and Human Rights. She received the 2000 National Caring Award, which was inspired by Mother Teresa and was recognized with the papal honor Pro Ecclesia a Pontifex from Pope Benedict XVI. In 2008, she was honored with the MacArthur Genius Award Fellowship. In 2011, Dr. Benjamin became the recipient of the Chairman's Award during the worldwide broadcast of the 42nd NAACP Image Awards. Ladies and gentlemen, I'm honored to present the 2019 Booker T. Washington Leadership Award to the 18th U.S. Surgeon General, Dr. Regina M. Benjamin.
Take a photo. Wow, thank you very much. I don't have a prepared speech, so you can be thankful for that. This is gorgeous. I'm really honored to receive such a beautiful and such an important award. Many of my friends out here always ask me, what am I doing now that I left Washington? I went back to my clinic in Biola Battery, Alabama, and we continue to see patients and see any person regardless of their ability to pay. But I also started a health policy research center focusing on, it's the Gulf States Health Policy Research Center, focusing on why do the states that border the Gulf of Mexico, Alabama, Mississippi, Louisiana, Texas, and Florida, why do we have poor health outcomes when we have great medical schools, we have great doctors? So I believe it has to do with the policies. So we've been working on that. And still involved with everything else and staying busy, involved with AMA, and thank you, AMA, for this. I just want to say that whenever I get an award, I have to think about the fact that I have oftentimes gotten awards. I remember having my picture in the paper, and the reporters are called, and they want to interrupt you all the time, and I want to see patients. And so one time I got a picture in the paper, and I got a few weeks later, I got an envelope, a manila envelope, with letters from 6th grade class. And each one of them said, I saw your picture in the paper, and I want to be a doctor just like you. So whenever I get a chance to have the honor of receiving an award, and whenever you do the same, just remember it's not about me, it's about who will see this and want to get an award for themselves as well, that we have to be models and we have to stand up for them. So this award is for all the future Surgeon Generals and the future doctors. Thank you.
Thank you, Dr. Benjamin. Now we'll have remarks by Dr. Gary Puckrein and Dr. Barbara McAneny.
Good afternoon. Before I get on with some business, I want to ask Congresswoman Kelly, who wasn't here this morning. She was playing the O'Hare game, and so we were excited that she was able to finally join us. So Congresswoman Kelly, please come up.
I will be short and sweet. I just want to welcome everyone here, thank the staff, and of course, our leader for another fine two-day conference. But we're thrilled to see all of you here because a lot of work goes into this, and we want people to get a lot out of what we have put together. And I want to thank the people that have already spoken and sharing your knowledge. We could not do it without you. And of course, always want to thank both of our staffs for all of their hard work. So enjoy. I hope you get a lot out of it that you can take home, and we can have a healthier world. Thank you.
So it's really been a tremendous pleasure working with Congresswoman Kelly and her staff on putting this event together. It's been really a great collaboration. I also want to take a moment to thank some sponsors. We could not do any of this without support from the many sponsors. And so I'm going to be announcing our gold, silver, and platinum sponsors. The American Medical Association, we really do appreciate, I just have to take a point of personal privilege here, the work that we've been doing with AMA and the wonderful things that they are planning around diversity, both in terms of workforce and clinical. It's been exciting to watch and be engaged with them on that. I want to thank Amgen. You may clap. A new sponsor, Avenir Pharmaceuticals. They're doing some really incredible work, and we thank them for their support. Biogen. Blue Cross Blue Shield. Centene. And you're going to hear more about Centene later on. They're really another company that's doing some really incredible work. Dexicom. Genentech. GSK. Eli Lilly. Merck. Pharma, Regeneron, and Sanofi. Without their support, none of this really would be possible, and so we are really grateful for that support. I'm now going to turn the program over to Barbara McAneny, who's president of the American Medical Association.
Thank you very much. It is, again, our great privilege to help sponsor this wonderful conference and this great organization. And it's a personal treat for me to get to see Regina Benjamin again, so another round of applause for Regina. I want to tell you some of the things that the AMA is actually working on, of which Regina had a big part in getting started. We have a minority affairs section, and that has been our way to make sure that we continue to focus on our need to make the profession of medicine look more like the people we serve. It is a major focus for us. The minority affairs section is free, and it's open to everyone to be part of. And I encourage you all to do that because they have some remarkable programs that you can find out from Craig Johnson, who's somewhere around in here. I can't see anybody. But to see what's going on. And one of the things that Regina just said that really resonated with me was that she got the letters from the sixth graders. Because one of the programs we have is Doctors Back to School. And that just shows children that it is possible for all of us to become physicians. We've all heard that before. I know when I was considering what I wanted to do, they told me that women were not physicians, so I should be a nurse. Nothing against nurses, but that's what I was told in my high school when I was looking at what I wanted to do next. And we need to stop that. We need to be able to, if we're going to change how our profession looks, and if we're going to do a better job at serving our population, we have to have a profession that looks more like the people. And that has to start. This is not an easy lift. That has to start way back in school-age kids and maybe before, where we say all these things are available to you. And we make sure that the educational processes are there, that we make sure that everybody has the ability and knows that they can make it in medicine or in nursing or in the health profession somewhere. We certainly are going to need everyone. I also will admit that I was very delighted for two reasons to see Dr. Benjamin become the Surgeon General. One was that it was great to feel like I knew a Surgeon General. And the second one was that it made her drop out of the Board of Trustees race that year, and I got in, so I thank her for not pushing me off the podium. So thank you, Regina, again. I wanted to also mention another thing that the AMA is currently doing to make sure that our focus on health equity is laser-like. And one of the things that we have just done is we have recruited a person whose job will be the director of our Center for Health Equity. Her name is Dr. Aletha Maybank, and she worked, yes. She's a pediatrician who has worked to promote health equity in New York City, and we felt that she would be an excellent choice to make sure that we focus on this in several arenas. The first is within the AMA, that we have to make sure that we practice what we preach, that we make sure that we are equitable in our treatment of everyone. Secondly, in looking at medical schools and looking at graduate medical education, to be able to say we want to further our ability to make sure that opportunities are there, that we get rid of the glass ceiling that we have, we get rid of the color barrier that we have, we make sure that we are promoting people into the upper echelons. And I'm going to embarrass Bill McDade, who's one of our Board of Trustees. Stand up, Bill. He has just taken a job with ACGME, where I understand that your job is to make sure that the residency programs and fellowship programs, the graduate medical education, is promoting our values for health equity. So I think that is key in making this whole movement move forward. It's about time. We know that when people see a physician who looks like them, they're more likely to be adherent to the regimen. They're more likely to understand what they need to do. They're more likely to have a better health outcome. So it starts with kids, teaching kids that they can become doctors. It starts with having a profession that is responsive to the needs of our entire nation. And we'll talk a bit more, and when I get to talk to you tomorrow, about some of the things we're doing in terms of the ACA and preventing the further deterioration of that, and Title X funding, which serves poor people disproportionately from everyone else. So we want to make sure that the AMA hears you. We want your membership with us. We firmly believe that we will advance all of these fields, all of these issues, all of these concerns much better if we link arms and we march forward together. Thank you.
Hey, good afternoon, everyone. I'm Brandon One, and I'm here to announce the Centene Corporation for the Excellence in Community Health Award. Centene, I'll tell you how we came about the decision to get this award. When I met with the advisory board last January, so advisory board members, stand up, raise your hands, acknowledge, yeah. When I met with those guys last year, they said NMQF does a lot of good work. They have all these data points. They're really, you have the mapping down, but you're not really in the community. You're not doing any programming. You're not really assisting folks and helping them out. And you have all the data points, but you're not doing the work in that space. And so I got the opportunity to speak with a couple of people about that, Joyce, Larkin, and Garrett. And they said, well, why don't we work together and do some community events, some clinics? Let's really get out in the community. So last summer, we did a tour where we went to Baltimore. We did one in DC, one in Baltimore, New Orleans, Detroit. Am I forgetting any other place? Chicago. And Chicago. And we did, and at each event, we had at least 1,000 folks come and receive services. And it was without the Centene Corporation, we wouldn't able to do that. So first of all, thank them for all that you do. And we also have a brief video. And without further ado, the 2019 Excellence in Community Health Award, Centene Corporation. Represented by Ms. Joyce Larkin and Mr. Carl Garrett.
Thank you so very much for this special recognition, and to all the honorees today. It's certainly an honor to salute and join you, and we're humbled by the award. But, you know, I made sure that Brandon understood receiving the award doesn't mean that the work is done. It's merely just getting started. And we're learning a lot as we go to your communities and as we meet with individuals and as we work with providers. We looked in about 6,000 pairs of eyes at the clinics, and we learned that school children couldn't see the board, the teachers couldn't see the board, the bus drivers couldn't see how to drive, and the janitors couldn't afford glasses. So it's not enough to just take a vision van and travel the country and give out free prescription glasses. We're actually building express lanes now in some of our community health centers so that vision services can become part of the regular health experience. We didn't forget about our veterans. We actually helped visit some of the homeless veterans as part of our Salute to Service, as part of our outreach into the community. We've gone inside the prisons to look at conditions inside the walls as it relates to health care, but then we're working with the Urban League and a lot of other community organizations on reentry. What does it look like when you come out without the doctor, without the connection, without the connection to family, and without the mental health counseling that you may have received inside the walls? And then last but not least, we have been honored that Xavier, a lot of the HBCUs have hosted us to bring the healthcare experience onto the campus and meet individuals. For us, it's all about recruiting, and not just recruiting our future doctors and nurses. Don't get me wrong, we love you all too, but we're looking for people to work in finance, marketing, communications, outreach, all the other parts of what we call this business of healthcare. So again, we are honored, we are humbled, and we remain committed. So thank you so very much.
Lunch was sure good, wasn't it? Gotta love the Ritz. I am so privileged. I mean it, they've got great food, I'm just saying. I'm putting my distance glasses on because it is just so awe-inspiring to be up here in front of you all. You guys are doing so much good work, and I thank you for what you do and partnering with us. I'm Laura Lee Hall, the Chief Operating Officer and Executive Vice President of Sustainable Healthy Communities, a wholly owned subsidiary of the National Minority Quality Forum. We've been around about 2.5 years now, and it's been a great privilege and honor to have joined with Dr. Puckrein to create this entity, to really get at the issue of not just data, and I salute you, Joyce, as well, but translating data into change on the ground in communities in a way that folks can own it and make it happen there and sustain it. So I have been working with the support of Santa Fe now for several years, and it is a real pleasure and honor to be able to acknowledge their commitment in the last several years and beyond to
population health, to equity, and to really making the sustainable communities we're also invested in seeing grow happen. It's a double pleasure to be able to give the award to my colleague and friend, the only person I've let do a selfie with me other than my children, Angie Bricco. She brings an infectious enthusiasm and a hard-headed businesswoman's attitude to making things happen in a big organization around the world. And she has really, along with many of her wonderful colleagues, been committed to research, which we have collaborated with them on, as well as quality improvement programs and community-based programs that are growing around the country. Come ask me during the meeting if we can bring one to your community. Indeed, just today, we issued a press release because we had an editorial in the international journal Vaccine that basically says we haven't seen flu shots increase in over 10 years, and why are we wasting our money on promoting flu shots if that's the result? We need to make sure that we protect all people, older adults, people of color who are less likely to receive a flu shot. We need to make sure their health is protected, and we need to work on that in a way that is impatient, maybe even a little angry. I mean, not angry. And that was an advisory group that translated into this publication supported by Sanofi. So I'm going to shut up. Please come see me so we can identify ways to work in your community and support your wonderful work. But join me in acknowledging the great work of Sanofi and my friend Angie Bricco. So we go stand over here?
Thank you so much to everyone, and thank you so much, Gary and Laura Lee. It has been a privilege on behalf of the entire Sanofi team to work on this project, which has been deeply rooted in our mutual values to help improve health equity. When I started working with Laura Lee and Gary, and I saw these data maps, I thought, wow, this data is power. What if we got it into the hands of people in regions that really want to work in communities to make a difference? And when we looked at our mission at Sanofi, empowering life for people that have chronic conditions to feel healthy, and at Sanofi Pasteur, our vaccine division, our vision is a world where no one suffers or dies from a vaccine-preventable disease. So when we were looking at these maps and seeing that the populations with diabetes and heart disease that were more likely to end up in the hospital if they got influenza during a flu season didn't have access to the flu vaccine and their immunization rates were low, we thought we had to take action. And thank you, Laura Lee, for calling me the driver. For those of you that stay after lunch, you'll hear more about our DRIVE project, which is demonstrating rising influenza vaccine equity. And we think we've made a turning point where we've been able to actually take this data, these motivated individuals, and the best practices on communications and quality improvement, and have seen an increase in immunization rates. And many of our partners are in the room here today working on the project. Congratulations to all of you. Congratulations to all of us working on this initiative, and thank you very much for this award. We look forward, as our partners at Centene as well, in trying to find ways that we can innovate even further and make a broader impact. So thanks again.
So I've been working in the area of patient advocacy, and now it's getting on about 20 years. And now more than ever, I've come to appreciate the real importance of patient advocacy. I almost think that patient advocacy is a new branch of medicine, because certainly in this town, if you ain't advocating, you ain't getting. That is a basic rule. And so the organized patient voice is profoundly important, often underestimated. Often people fail to recognize the independence of patient advocacy groups. But they're fiercely independent, and they're doing really incredible work. And one of the persons that I've had really a lot of interaction with is our awardee. This is the first time we're giving a patient advocacy award, and it won't be the last. But one of the things I came to appreciate about the work that Janet McUlskey been doing at Pfizer is helping to provide information to patient advocacy groups. Not information that was prepackaged and determined, but information that allowed patient advocacy groups to go back to their organization, understand the critical issues that were under discussion. Anybody that comes very close to our healthcare system will understand what a god-awful beast that thing is. It has got arcane rules and regulations that just make your eyes weep. And for a patient advocacy group, trying to follow, and I always love certainly government, because they always give you the opportunity for a public comment, and it's due the day after tomorrow, and it's got some you've never even heard of regulation that says we're about to cut off everything to everybody if you don't come and give us a comment. And so there's actually a network of patient advocacy groups here in Washington. We work together and we talk, and it's not by race and ethnicity. It is really a group that fights every day. And I'm sure most of you in this room don't even know they're there. But they are there, and they're working very hard. And we have turned to Janet McUlskey on many a day and asked for her support in understanding what the regulations mean. And it's not that Janet gives us the answer. She finds experts for us. Experts who are in some law firm back in the corner there, read some regulation, and God knows why they would even read the thing, but they've read it, and are able to give us some guidance. And that becomes profoundly important for minority populations. Because one of the missing things that people don't pay a lot of attention to in our community is we have very few think tanks. There's no Heritage Foundation out there. There's no Cato Institute out there that is helping to interpret these rules and regulations as it touches minority populations. And so the National Minority Quality Forum, independent of all the other things that we do, we look at those pieces of legislation. And we have a rule, and the House rule is we don't sign on anything that we haven't studied, that we haven't read, that we can't in good conscience say to our community, this is a piece of legislation or policy that is meaningful. So when we thought about a patient advocacy award, we thought of Janet McUlskey. That we've always been able to turn to Janet and say, because them experts cost money too, right? So we can turn to Janet and say, we don't understand this rule. We don't understand this regulation. What expert is out there that we can ask questions of? And frequently, that expert hasn't thought about it in the context of the minority community. So we can say to them, yeah, but, and I could cite a whole bunch of rules that sound okay, but when they touch the minority community, what you find is that we've created some tiered system where a whole bunch of people are not going to get access, but some privileged people will not. And it's made us the stronger and the smarter for it. So it's really with tremendous respect and really appreciation that we present this award to Janet McUlskey and hopefully introduce her to you and you to her because she really is a tremendous resource and we're deeply appreciative. So Janet McUlskey.
Thank you. The nice part. Oops, I'm sorry.
You gotta get your thing first.
Oh, God, yeah, sorry. Yeah. Do I do that first? Oh, okay. Sorry. I get so excited by all of that. Okay, perfect. That's all right, whatever. Thank you for that. And it's funny, Gary, when you were talking about what we do at Pfizer and what I do, it was almost the exact same words I was thinking about saying about NMQF, that the work that you do in no small measure really empowers the folks that you work with and for providing a platform, providing data, and really compelling attention to the health disparities and the root causes. So it was sort of an interesting parallel that I was thinking about what NMQF does. Sorry, I'm a little... So anyway, that's the work that we do in our community, and as I look around the room, there's so many people that I could point to, Sue Peshin and Dorothy Ochita and Frida Lewis Hall, of all the people that we've worked with through the years and who, as a community, to really get the patient voice out there, because it's easy to dismiss a patient voice, whether it's a multicultural patient voice or just a therapeutic area patient voice. It's easy to say, we're not going to pay attention to that community until you get the data and you get the real voice out there to be speaking on behalf of these patients, and then you begin to get the political machine to listen. But it's not easy. And Gary and I have been doing this. I said, one of my colleagues had said, you've been doing it for how many decades? Well, we don't really count because it's a lot. Whoever said, if I don't have my glasses, I can't see you, but then I can't see my notes. So that's what happens. But Pfizer is a fabulous organization that I'm really privileged to have been working with in the patient advocacy community for the last 18 years. We truly value the patient voice. It's what we do. It's why we get up in the morning and really, Angela, Melissa, Mia, these are all my colleagues that this is what we get up every day and do. And so I'm humbled. I'm thankful for the award. I feel like it's a team effort, not only a team Pfizer, it's a team all of us, because we've got to work together, whether it's the medical community or the patient advocacy community, the caregiver community. We have to all be speaking together and working out there on behalf of the patients. Otherwise, the bad guys win, and we can't let that happen. So thank you very much.
Thank you, Janet. Such a pleasant spirit. Let's give another round of applause for all of the awardees today. That concludes our program. Thank you so much for your time and attention. Enjoy the rest of your lunch. Well, you look like you're done, but I'm going to start eating. So enjoy the rest of your day. There are a lot of dynamic discussions to come.